Good day, everyone. Today, we are gathered here for a discussion regarding the required in the course BMMU 4053 Engineering Ethics and OSHE. The main topic of this discussion is the roles of the occupational safety and health regulations in the workplace. In this topic, we will discussion into two main elements, which are the first one, roles of OSHE legal requirements in business management, and the second one is the Occupational Safety and Health Act in Malaysia and its salient features. Before we start, let's start with self-introductions. So, my name is Khoo from 4BMMD, section 1/2.
My name
Next.
is Isuhao from 4BMMD 1/2.
My name is also from 4BMD section 1/2.
Okay, thank you for you all for the self-introductions. Let us get into the discussion now. So starting with the definitions, as we know in our country, Malaysia is a fast-growing country and well-developed, especially in industry sector. Therefore, the way OSHE management is implemented is very important. There are two act bondings or organizations in Malaysia in order to ensure the workers are being protected from all risks coming from the workplace hazard, which are the first one, Factory and Machinery 1967 or FMA 1967. The second one is Occupational Safety and Health Act 1994 or OSHA 1994. So based on this act, what do you think about the roles of OSHE legal requirements in business management?
Okay, thank you, Khoo. So, occupational safety and health, including compliance with OSHE requirements under national legislation and regulation and practice, is the responsibility and duty of the employer. The employer should demonstrate strong leadership and commitment to OSH activities of the organization and make appropriate arrangement for the establishment of the occupational safety and health in business management. The system should contain the elements of policy, organization, planning and implementation, assessment and improvement activities. For the first element is the policy. An OSH policy is a written document which expresses the organization commitment to employees' health, safety, and well-being. It is a foundation for the efforts taken to provide a suitable working environment. The policy shall influence all the activities, including the selection of people, equipment, and materials, the way work is done, and how you design and provide goods and service. Second, organizing. The employers has to clearly define responsibility, accountability, and authority for the SHMS. Every member of the organization should understand their respective responsibility, authority, and accountability for, for OSH issues. The organization should ensure that every employee is accountable for their health and also their core employees. It should also consider incorporating this accountability into job description where they exist and make a point of reviewing it during performance appraisals.
Okay, thank you, Suhao. So, Xixiang, what is your opinion or your information to share about this topic?
Yes, from the study, planning and implementation it also is an important element in the roles of in the to achieve the organization should prepare their OSH plan. OSH plan can serve as a roadmap. The plan should identify and allocate responsibility and authority to deliver the OSH objective, which is at each relevant level, and it will tell the organization what has to be done, when it has to be done, and who is the responsible and what to achieve. It should also identify the tasks to be implemented, allocate time scale to meet the related objective and resource like financial, human, equipment, and logistic to each task. And beside that is assessment. The employer shall identify hazard, assess, and control risk. Hazard identification is the process of identify hazard is in the workplace or for a work procedure. Risk assessment improvement involve the estimation and evaluation of risk level taking into account the existing control. For risk control, a project risk control should be established and implemented according to the level of risk identified. And last but not least, the improvement. The organization too should have the effective procedure for preventive and corrective action resulting from OSHE in business management performance, monitoring, and measurement. Audits and management reviews, preventive action are action taken to eliminate the underlying root causes of the potential non-conformity or potential undesirable situation in order to prevent occurrence.
Okay, thank you both Su-Hao and Si-Xiang for the explanation and informations regarding to this topic. And it's definitely helpful in understanding of the OSHE knowledge. Moving to the next topic is the Occupational Safety and Health Act in Malaysia and its salient features. So, as mentioned before, main legislation on occupational safety and health OSHE that being implemented in Malaysia are OSHA Act 1994 and the Factory and Machinery Act 1967. That being implemented by the Department of Occupational Safety and Health, which is DOSH. So, the Department of Safety and Health, DOSH, is the government agency that is primarily responsible for the administrations, management, and implementation of the OSHE legislations, which seeks to promote OSHE culture in all workplaces and ensures that all jobs and activities are secure and healthy for the worker. DOSH is in charge of ensuring the protections, health, and social welfare of the workers and protecting other employees and the public against the safety and health risks resulting from the following activities. So the first one is the manufacturing, mining, quarrying, constructions, hotel and restaurants, agriculture, forestry, fishing, transport, storage and communications, public service, statutory authorities, utilities such as gas, electricity, water, and sanitary service, finance, insurance, real estate, and business service. And the last one is a wholesale and retail trades. So for these sessions, I would like to discuss more about one of the legislation which is the Occupational Safety and Health Act 1994. Do you guys have any the details of this act?
Yes, I will explain the overview of Act Occupational Safety and Health Act 1994, which is OSHA 1994, provide for the regulatory basis for the promotions, stimulation, and encouragement of high protection and health at work levels. Law 514 provides a straightforward declaration that the responsibility for occupational safety and health at workplace are shared between the employers and the workers, since the employers are the ones who provide the working environment which give rise of hazard at work, and the workers are the ones who have to work with these hazards. The self-regulation approach allows the employers to develop an effective safety organization and efficiency through self-regulation schemes designed to accommodate the sector or the organization. Consultations must therefore be held between employers, employees, and the government on any topic related to safety and safety at work. And cooperation between employers and staff must be developed to safeguard and enhance safety and health quality at work. The aim of this act are to secure the safety, health, and welfare of persons at work against risk, safety, or health arising out of the activities of person at work. The second is to protect persons at a place of work other than persons at work against risk to safety or health arising out of the activities of persons at work. And the third one is to promote an occupational environment for persons at work which is adapted to their physiological and physiological needs. And the last one is to provide the means whereby the associated occupational safety and health legislation may be progressively replaced by a system of regulation and approved industry codes of practice operating in combination with the provisions of this act designed to maintain or improve the standard of safety and health.
OSHE 1994 defines the general duties into three main groups, which is first one is general duties of employer and self-employed persons. Second is general duties of designer, manufacturer, and suppliers. Third group is general duties of employees. So for the general duties of employer and self-employed person includes general duties of employer and self-employed person to their employees, and duty of formulate safety and health policy, and general duties of employers and self-employed person to person other than their employees, duties of an occupier of a workplace to person other than his employees, and penalty of an offence under section above. Second, as for duties of designer, manufacturer, and supplier, it includes A. General duties of manufacturer, and B. General duties of manufacturer like regard substance for use at work, and C is explanation to section A and B. D. Penalty for an offence under section A and B. And the next followed by a general include general duties of employee at work. B. Duty not to interfere with or misuse things provide pursuant to certain provision, and duty not to charge employees for things done or provided, and discrimination against employees.
Okay, thank you, Suhao and Xisiang. Next, I will explain about the regulations and orders made under this act. So the first one is Occupational Safety and Health, Employee Safety and Health General Policy Statement, Exceptions, Regulations 1995. The second one is Occupational Safety and Health, Control of Industrial Major Accident Hazard Regulations 1996, followed by the Occupational Safety and Health Committee Regulations 1996, Occupational Safety and Health in Classifications, Labeling of Safety, Data Sheet of Hazardous Chemicals, Regulations 2013. Occupational Safety and Health Officer Regulations 1997. Occupational Safety and Health Prohibitions of Use of Substance Regulations 1999. Occupational Safety and Health Use and Standards of Exposures of Chemicals Hazardous to Health Regulations 2000, and Occupational Safety and Health Notifications of Accident, Dangerous Occurrence, Occupational Poisoning, and Occupational Disease Regulations 2004. Followed by the Occupational Safety and Health Officer Orders 1997. And the last one is the Occupational Safety and Health Prohibition of Use of Substance Orders 1997. So I think that's a very detailed and much information discussion under the OSHA Act 1994. Let's move to the next following act, which is the Factory and Machinery Act 1967 in Act 139. So Factories and Machinery Act 1967 is another important regulations enforced by the Department of Occupational Safety and Health. It's the Factory and Machinery Act 1967, which was enacted to supersede the 1953 Machinery Ordinance of the States of Malaya. There were 16 regulations promulgated under the Act 139 was enacted in 1967, and it is the legislations in force until today to provide the control of factories concerning matters relating to the safety, health, and welfare of persons, the registrations and inspection of the machinery, and to matters related thereto. The FMA 1967 was amended in 2006 and gazetted on 14th of September 2006 and implemented on 1st of January 2007. The rationale for the amending the FMA 1967 was to provide the granting of the authority to the minister to license individuals or companies engaged in these activities under the Act, to update, improve, and clarify vague provisions, to ensure that the provisions of the Act are relevant to the current developments, and to facilitate the enforcement of the law, and to increase the effectiveness of the provisions of the Act. So the Factories and Machinery Act 1967 is an act to provide for the control of factories with respect to the matters relating to the safety, health, and welfare of the person terrain, the registrations and the inspection of the machinery, and for the matters connecting therewith. Do you guys have any information of this act that wanted to share or discuss?
Yes, I would like to explain about the regulation that contained in this Factory and Machinery Act. The first is Factories and Machinery, Steam Boiler and Unfire Pressure Vessel, Amendment Regulation 2005. And next is Factories and Machinery, Electric Passenger and Good Lift, Regulation 1970. Factories and Machinery, Fencing of Machinery and Safety, Regulation 1970. Factories and Machinery, Person in Charge, also Regulation 1970. Factories and Machinery, Safety, Health and Welfare, Regulation 1970. Factories and Machinery Administration, Regulation 1970. Factories and Machinery Certificate of Competency Examinations, Regulation 1970. Factories and Machinery Notifications, Certificate of Fitness and Inspection, Amendment Regulation 2004. Factories and Machinery Lead Regulation 1984, Malaysian Occupational Safety and Health Profile. Factories and Machinery Asbestos Process Regulations 1986. Factories and Machinery Building Operations and Work of Engineering Construction Safety, Regulation 1986. Factories and Machinery Noise Exposure, Regulation 1989. Factories and Machinery Mineral Dust, Regulation 1989. Factories and Machinery Exemption to Petroleum National Berhad, Order from 2013. Factories and Machinery Special Scheme of Inspection, Risk-Based Inspection, Regulation 2014. And the last one is Factories and Machinery Exemption to Certificate of Fitness for Hoisting Machine, Order 2015.
So from the Factories and Machinery Act 1967 is divided into 6 parts which contain part 1 is preliminary and part 2 is safety, health and welfare, part 3 person in charge and certificate of competency, part 4 notification of accident, dangerous occurrence and dangerous disease, part 5 notice of occupation of factory and registration and use of machinery, part 6 is general. So starting by part 1, preliminary includes of short title, interpretation of factory, interpretation general, appointment of official, supervision of official, official are public servants, power of an inspector, obstruction not to followed by part 2, safety, health and welfare. Provision relating to safety and second person exposed to exposure of explosive implement, lifting of weight, provision against fire, construction of machinery, dangerous part of machinery, projecting material, machinery for hire or sale must comply with regulation, machinery manufacture or repair must comply with regulation, certificate of fitness, duties of person employer, occupier, and provision relating to health, exposure to element, personal protective clothing and appliance, provision relating to welfare. Part 3, person in charge and certificate of competency, which is training and supervision of inexperienced worker, chief inspector make order in symptoms, young person, certain machinery not to operate without certificate staff, and panel of examiner and board of appeal. Part 4, notification of accident, dangerous occurrence, and dangerous disease. The occupant might notify the nearest inspector of accident and disease. Incident include loss of lives, injury to person who lost more than 4 days' work, and serious damage to machinery or other property. Session 13. An inspector may investigate accident and dangerous occurrence and hold inquiries into more serious cases with under Section 33. And Part 5, Notice of Occupation of Factory and Registration and Use of Machinery. Notify Department of Occupation Safety and Health, which is OSHE, within 3 months of the intended start date under Section 34, Operation of Factory. And building operation must start if less than 6 weeks. Building operation of work of engineering construction, which is under Section 5. And lastly, Part 6 is general, which is chief inspector power is under Section 49, and general penalty 2,000, and certain section is 5,000 ringgit, which is under Section 1. And power to modify agreement, the owner may apply to the High Court for the terms for the agreement to be assigned or modified. Is Section 53, and medical supervision is Section 57. It is and cases of an illness have occurred which he has reason to believe may be due to the nature of the process or other condition of work, and there may be risk of injury to the health of person employed in any process, or the person below the age of 18 years are or are about to be employed in the work which may cause risk of injury to health.
Thank you both presenter Suhao and Sisiang for sharing and explaining the informations and details of the FMA 1967. And I think by this sharing, we're able to learn and gain more knowledge of the both of the acts that are being implemented in our country. So as conclusions, although more than 18 years have passed since OSHA was first implemented in Malaysia, OSHA has not been evaluated. Malaysia has always been a fast-growing country for the past 3 decades. Certain provisions are in a place that may no longer are compatible with the current situations. Therefore, I wish by these discussions, we are able to apply the knowledge and awareness of these particular issues and make more changes and improvements by our generations continuously. Lastly, good job and thanks for you all for all the valuable time for joining these discussions. And stay safe and goodbye.
Thank you. Goodbye.